Hi, my name is Leslie, and today we're going to be doing a pediatric assessment on a 5-year-old, and we're also going to do an IV push. So first things first, when we come in, we want to introduce ourselves. We want to provide privacy. We want to make sure we're gathering supplies. We want to make sure that we're raising the bed to a working level. In this situation, when we do or are doing it on an assessment on a child, we always want to make sure we introduce ourselves to the child, but also the caretaker of the child. Today we were going to have the child's mom present, so we always want to make sure we do that, and then hand hygiene. So first things first, I want to go ahead and just name, since we are going to be doing an IV push, I want to go ahead and name 2 veins that we can do on a pediatric child. So the first one will be the cephalic vein, which is going to be in the arm. And then I'm going to remove the blankets real quick. And then the other one, we're going to be doing the dorsal venous vein, which will be on the child's foot. But we'll do the IV push later. So again, we're going to come in, we're going to make sure we introduce ourselves. One big thing when doing any kind of assessment on a child is that we want to make sure that they are comfortable and they are in a safe environment. So we always want to make sure we put any supplies or anything away that they can't get a hold of. If they have a blanket or the pillow that they have for comfort, we want to make sure we let that keep that with them, so they're calm and comfortable through the assessment. And we want to involve them as much as we can, asking them any questions or anything like that. So first thing, we want to make sure that their developmental stage is where they need to be. So in our situation, our patient is 5. So we want to make sure we're checking certain things like his teeth. He has all of his teeth, so that means that is a sign that he is closer to the age of 5. We also want to see if he's potty trained. If he's potty trained, that's also a good developmental blocker to being around his age. And then if he can count to 10, do his ABCs, and using more clear sentences with us, that's also developmentally where he's supposed to be at. So we also want to go ahead and check his overall behavior. Is he making good eye contact with us? Is he happy? Is he smiling? We always want to make sure that he is happy and an overall good mood and good behavior. So if there's any other like sadness, anger, that will be kind of a behavioral flag for us. And then we always want to make sure that we're checking the patient's name and date of birth, where he is 5. He could be limited to some things. At this point, hopefully they should know at least their name. So we want to ask him, what's your name, what's your age, maybe what's the weather outside, just kind of see where he's at. And then we always want to confirm with mom to make sure that those are correct, and then always checking the armband. So after we do all that, we're going to go ahead and do vitals. So when we do vitals, it's very important that when we take blood pressure, we use an appropriate cuff for this patient, because that could throw a abnormal blood pressure reading. And we're going to put it on the opposite arm of the IV, not to mess up the IV in any way. We'll apply that, making sure that's connected. And then on the opposite hand, we're going to check for the oxygen and the pulse. And then we're also going to check their temperature, and we're going to do auxiliary. So we're going to do under the armpit. And all of the vitals look to be in the normal range for a 5-year-old. And then we always want to make sure we're asking for the patient's pain level. If they aren't able to speak to us, then we would do the pain scale with the, if they aren't able to give us a more clear answer, we would do the scale where the faces are out and they would point to which one. But in this case, he is able to verbalize that he's not in any pain, so we're going to go with a pain scale of 0. We'll move that out of the way. And we're going to go ahead and start with our assessment. So we're going to start from the head and kind of work our way down. So first thing, again, we're going to start with the head. We want to look to make sure that there's no lesions, there's no redness. We want to make sure that there's no lice present in the hair. It's always important to check for that. Make sure there's no bulging, it's round, symmetrical. Any issue with that. As we want to work our way down, we also want to make sure that there is no skin breakdown on any of the skin anywhere. That would automatically be a red flag, and that we need to let the doctor know. So after checking the head out, we're then going to go around to the face. So we're going to get a pen light, and the first thing we're going to check is our patient's eyes. So we want to make sure the pupils are constricting, that they're equal, round, accommodating, and that they are able to follow commands. So we're going to go ahead and check their eyes. Very good. Both eyes constricted. They are equal, rounded, and then we would take the light and have them follow. So we'll start the middle. Very good. He was able to follow with no issue. So eyes look okay. We also make sure there's no redness, drainage, if he wears glasses, contacts, anything like that. Then we would move on to the ears. So kind of the same thing. We're going to look for redness, drainage. We're going to look at the ear wax. We're also going to check hearing, but we're going to do that when we set them up to listen to their lungs. So we're just going to take a look in there, making sure that everything looks okay. Very good. And then we're also going to check the nose. Same thing, redness, drainage, anything that would kind of flag them normal, any lesions on anywhere. And then we're going to check their oral cavities. So we're going to make sure that their teeth are still all in place, any signs of cavities. We want to check their mucus brains, making sure that they're moist and intact. If they're dry or anything like that, would indicate some dehydration issues. Everything we're going to look in, everything looks to be normal. We're also going to make sure that he is able to swallow, making sure that he can swallow good, and there's no issues with that. Then we want to check out for symmetry. We want to have the patient smile. If there's drooping, that would be a big no-no. We also want to make sure that we're having them move their eyebrows up, making sure that's also symmetrical as well. Then we're going to move on to the patient's arms. So a couple of those. So what we always want to do first thing is look for symmetry and length, making sure they are equal, that they're the same length. We want to make sure that he can move his hands or arms, he can extend and flex. So we're going to have them move up. An activity you can do is get a small ball and just kind of have them throw it to you and kind of back and forth to make sure that those arms muscles are good. And then we always want to check their cap refills in both hands. We want to check the peripheral pulses, so we want to do the radial in both hands. And then making sure they can rotate their hands out. And then we're going to kind of move our way back up to the neck. We're going to make sure that the patient can move their head up and down, side to side. We're going to check the carotid pulse. So we're going to check that on one side on each time for 1 minute. Very good. We're going to move to the other side. Very good. And then we're also going to go ahead and take a listen to his heart rate. We're going to do that for 1 minute, his apical heart rate. So we'll go ahead and listen to that. Again, you want to listen for 1 full minute. Very good. So after after we checked out his head, neck, we done the arms. Oh, and also we want to make sure we're checking the muscle tone in arms, legs, everything like that, that they're not flabby, that they're good and strong. So another activity we could do is just having us move his arm, showing us his muscles. That would kind of involve the patient a little bit as well. So after we check all that, we're going to move on to his chest and his lungs. So we always want to make sure to check the symmetry, that he's breathing in and out okay. We want to make sure that we're checking his respirations. They're not shallow, they're not too fast. And then we're going to go ahead and listen to his lungs. So we're going to listen 10 on the front, 10 on the back, 4 on the side. And we're going to listen to 2 on each side. Very good. And then we're going to go ahead and listen, lift the patient up carefully, and we're going to listen to their back. We'll listen to 10 on each side as well. Okay. And then while we have the patient sitting up, we're also going to go ahead and check his hearing. So we would have him cover up his ear, or one of us cover up his ear, move back a little bit, and we're going to have, we're going to whisper a color. So in this situation, we'll say blue. If he repeats that back to us while being a little bit back, then his hearing is good. We would do it on both sides. For the left, I would do blue. For the right, I would do red. He was able to repeat back, so that means his hearing is normal. So we're going to sit him back down. So again, making sure he's breathing in and out okay, respirations are normal. We also want to make sure we're counting those as he's breathing in and out. And then we're going to go ahead and move down to his belly. So we're going to go ahead and take a listen to the belly in all 4 quadrants. Very good. All 4 quadrants are active. We would also take a minute. We're going to lift his belly up, his gown up a little bit. We would inspect the chest, make sure again everything is raising okay. There's no lesions, redness, and then we're going to palpate the belly, making sure we feel no lesion or hernias. There's no lesions, and asking if there's any pain when we're feeling the abdomen. So there is no pain. We're going to come him back up. At this time, we would also kind of ask about his diet, and we're going to ask about the appetite, making sure he's eating okay, 2 to 3 or 3 times a day with some snacks. We would kind of, at this point, also trying to involve him by asking him, like, what does he like to eat, some of his favorite foods. We can look at his speech when he's able to tell us this as well, kind of involving him and looking at his speech, making sure the sentences are clear. We would also confirm with mom. Like I said, we want to involve the child as much as possible in the care. So making sure he's getting all the vitamins, minerals. We would then move on to kind of the urine and the bowel. So we want to make sure they're pooping okay. We want to make sure they're not having any diarrhea, constipation. We want to make sure they're not having any burning when they pee. We want to check the general area out, making sure there's no redness, there's no drainage, bruising, any abnormalities down there. And then if all that looks okay, we're going to go ahead and we'll move down to the legs. So we're going to cover him back up a little bit more, so for privacy. And then we're going to uncover, and we're going to check out his legs. So first thing, we want to look at symmetry. So we're going to kind of put them together, make sure the length is okay, everything looks normal. We want to have the patient kind of bend their legs up a little, making sure those muscles are good in their leg. We can also feel the femoral artery while we are assessing the legs, and we can also check the pedal pulses when we're checking the legs and checking the cap refill. And then one thing we want to do is have the patient take their foot, push against our hand, and we also want to make sure they can push it back towards us as well. And then we also want to make sure they can abduct and adduct their legs. So they can do this themselves, but we'll have them bring it out, bring it in, and we will do that on both legs. Very good. And then at this point, we would set the patient up to help them out of bed. And we're gonna have them walk just to check out their gait and their balance. So we're gonna have them walk in a straight line, have them come back. When they come back, we'll have them check their balance, just saying if they can stand on one foot, and just see how long they can, making sure that balance is okay. And then we're going to check their spine, so we're going to have them bend straight down. We're going to take our fingers, kind of rub down through the spine, making sure their spine looks okay, and that that's normal. Once that's done, we're going to put them back in bed. Again, we always want to make sure we're checking the strength, so seeing how far the patient can push down, having the patient grab our hands, making sure their hand strength is good. We want to make sure there's no muscles that are flabby or weak. So we're going to cover this patient back up. While we're also down on the legs, we also want to check for edema, making sure there's no pitting edema, and we want to check that throughout the legs, and we can also check that on the hands as well. So now we're going to cover our patient back up. Again, there was no redness or any kind of bruising when doing the assessment. And then we also want to check the skin turgor, making sure that that's okay. Okay. All right, and I think that is all, making sure that everything is symmetric, there's no breakdown, no redness, checking all the pulses. So we're going to go ahead and move to the IV push. When we're doing an IV push, again, we always want to make sure we're doing hand hygiene. We're introducing ourselves. We want to make sure that we're checking the MAR to make sure we have an order for this patient, and we want to use 2 patient identifiers. Like I said in the beginning, he is 5. He's going to be able to do the best he can with us. So we want to make sure we check the wristband, and we want to make sure to check with mom to make sure we have the correct patient. So we want to go ahead and verify. We want to do the 3 medication right, to make sure we have the right medication. So then we're going to go ahead and do hand hygiene and apply gloves. Okay, and we're going to go ahead and remove the cap and unclamp. And then we're going to take an alcohol swab. We're going to clean the hub, allow it to dry. We're going to take a flush, maybe. Okay. And then we're going to push just a little bit and then pull back to make sure that there's blood flow. If there is, then we want to go ahead and advance. We're going to push it slowly. All right, once we get the flush through, we then want to remove. We're going to clean the hub again, allow the dry, and we're going to administer the medication. And we always want to make sure we administer very slowly, 1 to 2 minutes. We want to make sure we're following our facility guidelines, but typically is 1 to 2 minutes, just so we always want to double check. So we're going to push that slowly. And while we're pushing this medication slowly, we want to make sure we're checking out the IV site itself. We want to make sure that there's no redness, that there's no leaking or any of that. We also want to make sure we assess the site before we get started pushing any of the saline medication, anything like that. So always assess it before, and you want to assess it while you're doing any kind of push. So once we get that all pushed through, the site looks to be okay, we're going to remove. We're going to clean the hub again with alcohol, allow it to dry, and we're going to flush another saline. Again, we want to make sure we do this slowly for the same amount of time as the medication. So 1 to 2 minutes. We want to flush. Again, assessing. We also want to go ahead and take the time to look at the patient, since we did give them the medicine, how they reacted, if they're feeling okay, how making sure there's no side effects, or making sure that they're not going to anaphylactic shock in case of allergies. You also always want to make sure you check the allergies before you do anything with this patient. That's a big check. All right, once the flush is all the way through, everything looks good, we're going to put on a new cap, and we're going to clamp that off. Clamp. There we go, making sure everything looks normal. We want to make sure the patient's comfortable. We're going to go ahead and remove gloves, do hand hygiene, and then we always want to make sure we go and document immediately what we gave, what time, what route, and then we want to come back and reassess our patient, making sure that again, we're not having any side effects, that the patient is okay, and that the medication was effective. We always, again,